Good morning. Today we have invited Dr. Sujith Senaviratne, Associate Professor, Director, Cardiac CT Service, Interventional Cardiologist, Monash Heart and Monash University. Good morning and welcome to the studio, Doctor.
Good morning, Sally, and thank you very much for inviting me.
How does a patient who have this, how do they get to access to your facility?
Generally, what happens is these tests are recommended usually by a cardiologist, and when recommended by a cardiologist in appropriate setting with the symptoms, they are generally covered through Medicare. And sometimes these tests or another variant of this test called calcium score may be done to assess your risk, and in these situations you often have to pay for the test because it's not covered by the government Medicare system, and that can be either done through the GP and more commonly through a cardiologist.
And you also had some information with regards to the stents being put in and the valves being done and stuff like that. Would you be able to get to that and explain that to us as well?
Yes, Sally. So what I'll show you is a situation where somebody presents to the hospital with a heart attack, particularly a particular type of heart attack, and I'll show you what we do. So what you can see on your left-hand screen was a normal coronary artery, and on your right-hand side you can see that the coronary artery suddenly stopped halfway through. And here what you can see is that we have actually opened the artery with a wire and a balloon, and on your right hand screen that you can see an inflated balloon. Just to repeat what I mentioned, once somebody comes with a heart attack, if it is a particular type of heart attack, we actually try and open the artery within about half an hour to 90 minutes from presenting to the hospital, and often the team is activated when the patient is in the ambulance, so it's a very efficient system. And once the patient comes in, they often directly go to the cardiac cath lab regardless of the time of the day or the night, and we generally perform the procedure through the wrist while the patient is awake with a little bit of sedation, and we pass a small wire through the narrowing, which actually often opens the vessel, and we inflate a balloon where the narrowing is, that opens the vessel, and then finally to keep the vessel open we use a metal tube, and that's what is called a stent. And some of you may have even heard that there are stents being manufactured now which are dissolvable. So in other words, instead of the metal stents, we now developing stents after months. These stents dissolve and just leaving your own artery. Anyway, that is...
So the narrowing is made enlarged, becomes normal, and once it dissolves, it just functions as per normal?
Correct. So basically what happens with a stent is that you have cholesterol, and that's pushed against the wall, and the stent stays like that for several months, and if you use what you call the bioabsorbable stents, then the stent will eventually dissolve, leaving your own artery. So it is an emerging field. Perhaps I would expect in the next few years these stents will be used more and more commonly. Having said that, there is nothing wrong with the type of stents that we got, which are metal stents, which are what you call drug-coated stents, which is most commonly used stents. They have excellent long-term results. So whether it's bioabsorbable stent or whether it's a standard stent, at the moment there is no major difference. And again, just to show you, compared with the initial pictures, this is once we put a stent in and the artery is fully open. And the whole procedure may take something like 45 minutes or so to do. So it's a relatively straightforward procedure these days, and we can bring the artery practically back to normal. Now, however, two important messages. One is that if you actually present late, that means there is damage done to the heart muscle, and that damage is not always reversible. So longer you stay at home without presenting to the hospital, the more the permanent damage is. if you
When you
present.
say- sorry, doctor. What is the time span you're looking at? Is there a window of time that you're looking at?
We say time is muscle. So sooner you present to the hospital, the better it is. If you can present within the first half an hour to 45 minutes, and we would expect virtually minimal heart muscle damage. Whereas if you present 5 to 6 hours down the track, then often there is permanent damage, and it could potentially be quite significant damage, even if you manage to put a stent and open the artery at that stage. And the second important message is not only you lose muscle, you're putting your life at risk. We know that if you're 40 years or older and living in Australia, your chance of having a heart attack by the time you're 70 is 50%. So 1 in 2 people who are age 40 and above will have a heart attack by the time they reach 70.
By the time or within the time period? Within that time
Within
period.
that time period. So the issue is that there is a significant mortality associated with it. There's about 10,000 people who die every year in Australia from heart attacks, and 50% of all deaths actually happen outside the hospital. That means people have delayed presenting to the hospital, think that this is not coming from the heart, the symptoms going to go away, and 25% of all those deaths actually happen in the first hour of pain. So it is important to act early and present to the hospital early, and again, not to drive yourself, to call the ambulance and get to a hospital as soon as possible.
Talking about cardiac care, what's your take on the cardiac care in Sri Lanka?
Cardiac care in Sri Lanka has come a long way in the last few years, and particularly in Colombo and areas around Colombo and Kandy and major cities. Most of the major facilities are there. I would say there's still some way to go, but and there's a big discrepancy between where you access the system. But I would say that it is steadily improving.